Anyone getting into cosmetic dentistry needs to understand the importance of dental photography. I take the exact same photos on every single one of my cases to achieve results like this and like this. Now, these photos can be taken with different setups. There are loads of different setups out there, and I'm not going to make that part of this video. Maybe if you want, I can make a video in the future about the different setups. I think at a basic minimum, have a camera, obviously, have a lens, and I would say get a twin flash. I think ring flashes don't really show off the work well enough, and at a basic requirement, get a twin flash. And there's different setups you can get with twin flashes and stuff, but like I said, I don't really want to go into it too much. What I really wanted to talk about was the exact photos that I take, and these photos I take for a variety of different reasons, but one of the main reasons is planning. Because if whilst taking these photos, I'm able to analyze the patient's smile in a variety of different ways to allow me to design their new smile more accurately, to produce a smile that suits them and looks more natural to them. But also, photos can help with communication as well. If you're in a consultation, taking photos are super important, and putting the photos on a screen and going through certain things that the patient has will make you sound more clear, and they'll understand you a lot more because they can see what you're talking about, and also they'll believe you more because they can see what you're talking about. Photos are great for communication, they're great for marketing. Obviously you see all of these before and afters, you need to take good photos for that. Another very important, if you're a young dentist and you're an ambitious dentist wanting to get better, taking photos allows you to learn, and taking more photos and analysing the photos and seeing things that you've done well, things that you've not done well, will allow you to get more from the case and learn more from the case, and it'll allow you to get better quicker, which is super important. So the first set of photos that I always take are face photos, and this will allow me to assess the facial aesthetics of the patient, how the smile relates to the patient's face. And the first photo that I take is from the front, and the patient smiling wide. And this photo is probably the most important photo. If I could only pick one photo that I could take in designing a smile, it would be this one. But it has to be done in a proper way. You need to make sure that the patient's chin is parallel to the floor, the chin's not up, the chin's not down, and you need to make sure that they're smiling fully. A lot of patients that come for consultations, obviously they're not happy with their teeth, and a lot of them subconsciously, when they smile, they don't smile fully. The top lip doesn't go as high as what it probably would if they didn't have this insecurity, and the bottom lip sometimes also covers the top teeth as well. So you need to make sure that you're encouraging, educating, and almost forcing the patient to smile fully. And this gives you a lot of information on the facial aesthetics, for example, the incisal plane and how it relates to the interpupillary line. And obviously they should be parallel to one another. It gives you information on the patient's dental midline and how it relates to the patient's facial midline, both in position and in inclination. And also it can give you information on buccal volume, the buccal corridors that the patient has, and whether they need to be widened, or maybe they're too full, or maybe there's some asymmetry there as well. Really, really important photo. The other face photos that I take is from the side at 45 degrees. This will give you information on the proclination of the teeth and how the patient's teeth sit in relation to the patient's face from a horizontal view. And then lastly, you've got profile photos as well, directly from the side, which will give you information on skeletal classification and all of that stuff, which will help with orthodontists, which we're not really talking about orthodontics here, but you can take those photos, and some of the cases will be orthodontic cases, so taking them and getting into the habit of taking them is important. The second group of photos that I take is smile photos, your mouth photos, and these are just close-up photos of the patient's mouth. This will give you information on smile aesthetics and how the teeth relate to the lips. And the first one, of course, is from the front. Similar sort of advice that I give you to face photos, where you need to make sure that the patient's smiling wide, but this gives us more detailed information on the teeth, the incisal edge position, the incisal proportionality between the centrals, the laterals, and the canine teeth. It'll give you information on the lip line, the smile line, how the teeth relate to both lips. It's super important here to also take a photo of the mouth whilst not smiling. And this is a photo with the lips at rest, and this will give you information of the incisal edge position of the central incisors, which is probably one of the most important elements of a smile design. The incisal edge position of the central incisor will determine the whole smile really. And having this lip at rest photo is super important, and it can be quite difficult to carry out. I normally get the patient to gently put their lips together and then ask them to gently separate their lips, and that is normally the position that they can get. But you know, some patients can be funny and they do all sorts of things, but it's very important to try and capture this photo. Other mouth photos are from the side, similar to the face photo. This time you're focusing on that lateral incisor, and again you're seeing the proclination of the teeth, you're seeing the 3, 4, 5 region this time, and you're seeing how the horizontal position of the teeth relate to the patient's lips. And the last photo of the patient's mouth and smile is from above. And to do this, you just simply ask the patient to put their chin down, and you take a photo from above. And this gives you information again on the horizontal position of the central incisor in relation to the bottom lip. Ideally, it's inside that bottom lip. If it's outside, then maybe the teeth are too far out. And if you're planning on adding volume restoratively, then you need to be very careful. You might give the patient horse teeth. No one likes horse teeth, so you need to be very careful. The other thing that you need to be aware of with this photo is the arch symmetry. As you take the photo from above, you can see if one side goes in or one side goes out, and if you're developing a new smile, you want to try and even out the asymmetries in the arch and give them a more of an even arch that fits in the frame of their lips. The other photos that we take of the mouth is retracted photos, again mainly for orthodontics, and I don't really want to talk about orthodontic stuff too much here. It's an all different realm, and you know, orthodontics are a little bit lazy. They're doing the easiest treatment. They don't even do anything really. They plan treatment and they give it to the orthodontic therapist. So it's a bit of a lazy type of specialty in my opinion. If you're an orthodontist, sorry, don't get offended. But retracted photos give us information on classification, incisal classification, they give us information on crowding, and then you've got the occlusal photos, again, crowding and all this other jazz. But I'm going to focus on a different type of photo which is super important, and these are the contrasted photos. Retractors in and a black contraster. This allows us to assess the soft tissues, it allows us to assess the gingival line, the position, the symmetry, the shape of the gingival margin. Very important. And if you want to be a good cosmetic dentist, then you need to spend time and learn how to make sure that we're achieving good pink aesthetics. But on top of that, these contrasted photos give us information on tooth aesthetics. So we're talking texture, we're talking translucency, facial embrasures, incisal embrasures, all of these details which come about as part of tooth anatomy, you will be able to observe in the patient's teeth on these contrasted photos. Really, really important. And one little tip that you can do is if you're taking these contrasted photos and you want to assess the color gradient, the translucency levels, you can alter the contrast, you can alter the color saturation and the brightness, and that can give you a lot more information on that. But I think in terms of aesthetic dentistry and improving people's smile with composite or porcelain, I think the most important photos are the face photos smiling, the mouth photos smiling, and from above, very, very important photo, and these contrasted photos. And the reason that you need to do this for the planning is because if you're trying to carry out a smile makeover that looks like it's part of the patient, which a lot of the patients who come to our clinic in Cheshire here, Loom Dental, they want a natural, beautiful smile that suits them. And one way we do that is by carrying out a lot of planning on the patient's smile, and a lot of the features that the patient currently has suits them. That's what they've had genetically. And if we can copy that in their new smile, whatever features they have, then their new smile will also suit them. Obviously, if they've said specifically they don't want this specific feature, then you don't want to copy that. But as a whole, a lot of these features, to get a natural smile, you want to try and copy off a lot of the features that they already have in their existing smile, and almost not transform it or change it completely, but more enhance these features so that they look more aesthetic and beautiful. And taking these photos and getting into the habit of taking the same photos in the same systematic way with the right settings, which again we can talk about in another video, is very, very important. And now I can be able to take the photos in a matter of minutes and have them on the computer. We've got a workflow. Sometimes my treatment coordinator takes the photos, sometimes I take the photos, sometimes my nurse takes the photos. but getting into the system of taking the photos, uploading it on a central drive with the patient's name, uploading it on their patient management software account, is very, very important. And like I said, for the other reasons as well at the start of this video, marketing, communication, and learning, very, very important to get into the habit of taking good quality photos with the right camera setup. And there we have it. That is my take on dental photography. I'm so glad that I got into dental photography because it is one of the things that really shortened my learning curve. You can learn a lot quicker by taking good quality photos and provide high quality work by taking good quality photos. If you found this useful, or if you want more information on dental photography, maybe about setups or about settings, then comment on the video, like, subscribe, and I will see you on the next video to provide you with hopefully some more useful advice that can help you in your dental career.